Next, I want to go over with you a couple of self-releases. So as you know, often you're feeling a lot of pain and tension through this area and coming right up into the base of the skull. So there's some really easy ways that you can release this yourself at home. So the first way is to take your hand and just take it over your shoulder and it's like a pinching action. So the action is kind of like this. So you're just grabbing onto that bulk of the muscle there, really getting the palm of the hand into it and the fingertips. And imagine like you're kneading some dough and you're just working all the way along that muscle. So starting out from the shoulder and working your way in and just pinching that soft tissue, that muscle in between. If you find a spot that's particularly knotty, I've got one in there, you can get in there and you can work on that. So you might even stop there and do some little circles. If you find this is quite tiring, you can use your other hand to hold the elbow up, which makes it a lot easier. If you want to get a little bit more pressure, you can do it with your pincer grip, so with your finger and thumb. A lot of people find this is a little bit harder on their hands, but certainly you can get more localized with it. But generally I find people can just get in and do this one quite comfortably. And then obviously you go over and do the same on the other side. So if you find a spot that's particularly knotty, uncomfortable, you could spend a little bit of time there even getting in and giving some little circles, little massage into that area. If you've got a headache, this can be aggravating. So these exercises are best done as preventative exercises. And the idea is if you're doing them every day, you're keeping on top of the muscles and then it's not going to get so bad that it's bringing a headache on. You can take that exercise and make it a little bit more advanced by adding in a head movement. So what you're doing, same exercise, you're grabbing on, you're pinching, you're supporting the arm if you want. And then what you can do is actually turn your head to the opposite direction or tilt your head to the opposite direction. So you're using your hand to almost pin the muscle and then move in the opposite direction, which puts stretch on the muscle. And again, you do that on both sides. The next one is what I call a suboccipital release. So you've got those little band of muscles right on the base of the skull that often get really, really sore and tight in headache sufferers. And again, this exercise is not recommended to do whilst you've got a headache because it will stir it up. So it's one that you should be doing morning and night as a preventative measure. So the best way to do it is actually lying down because your weight is off your head, but I'm going to show you in sitting and you can certainly do it in sitting. I often get people to carry a little jar. I recommend Physio cream, but any of those warming creams that you might use, carry some of that in your handbag. So if you're feeling a headache coming on at work, if you get it soon enough, get some of the cream and you can massage the cream in so you're getting like a double treatment. The cream's going to heat up the muscle and then the massage as well. If you can get it soon enough, sometimes you can almost nip the headache in the bud. But if the headache gets too set in, then all this is going to do is stir it up. So being really careful when you choose to do this exercise. So I'm actually going to turn around and show you what I'm going to do from the back. But basically I'm going to get my thumbs in under the base of my skull and I'm going to be working along the base of my skull doing tiny, tiny little circles, and my fingers are just going to be counter pressing on my head. So if I just turn around and show you what that looks like. So as you can see, I worked in and out, in and out. It's nice to do it that way, but if you come across a spot that's particularly sore or feels particularly knotty, I would actually stay and even hold the pressure on that spot. So you might hold it to a level of about 7 out of 10 on the pain scale. So you don't want it to be excruciating pain, but you do need to feel it. Just hold and maintain that pressure. And you can count to 10, 20, 30 seconds. You can even hold it up to a minute or two. And what you should find with that sustained pressure is that that knot should feel like it just melts away. So to start off with, it feels like a really like a knot, a little rocky bit in the muscle, and then with that sustained pressure with your thumb, it'll feel like it just softens and just melts under your thumb, and then you know you've got that trigger point and released it, and then you can go along further into the center of the spine, and as you find more of those knots, you can just work them as you go. So I really thoroughly recommend you do that on a daily basis rather than waiting until the headache comes on or waiting till you're not feeling great, because then it's really hard to undo all the knots. So these exercises are always best done. Although we call it self-treatment, it's really probably should be called self-management strategies. So there was 3 of them. So the eye exercises, the self-release exercise to the big upper trapezius muscle, and then the little circles to the suboccipital muscle. So good luck with that. Make sure you do them every day, and hopefully you'll be getting a lot less headaches before you know it.